In 2010, Barack Obama, as part of the health care reform bill, mandated that all health insurance plans provide women's preventative health care services. These preventative services include screening for diabetes, testing for HPV, counseling and screening for sexually transmitted infections, counseling for breastfeeding and domestic violence, as well as the coverage for birth control and the morning after pill. Unfortunately, these actions have resulted in strong oppositions from Catholic groups across the country. Today, in an effort to clarify these issues, we have assembled an expert panel to get to the core of these issues. Joining me today is Laura Klompus, a well-respected member of the Catholic Church and Public Relations Officer for British Columbia.
Thank you for having me here today, Graham.
And thank you for joining us, Laura. As well as Eric Hoffman, a member of the British Columbia Humanist Association and representative.
Thanks for having me.
And thanks for joining us. Eric, let's start with you. Why is it exactly that the President has risked the ire of the Catholic Church and mandated this bill?
Thanks, Graham. The President has not passed the bill with the intention of raising the ire of anyone. He's made a conscious decision to address preventative care. It is much less expensive to prevent health issues from occurring than to address a health issue that has already occurred. Specifically, when it comes to women, he is acting under the advice from the Institute of Medicine that contraception should be part of any preventative care package. 50% of women between the ages of 18 and 34 were struggling to afford contraception. This bill ensures that all women in the United States will have access to contraception and can take control of their own health.
Laura, do you agree with what Eric said?
Thanks, Graham. What President Obama has done by mandating this bill is force Catholics and Catholic institutions to pay for abortifacients and contraceptives. The Bible urges us to be fruitful and multiply, and the use of chemical contraceptives is in direct opposition to the teachings of the Catholic Church. This new healthcare bill violates our Fifth Amendment right of freedom of religious practice. What is so deeply offensive about this bill is that Catholic bishops have been among the strongest advocates for healthcare and its global access for all that need it, especially the poor and most vulnerable. This bill insults the contributions that the Catholic Church has made to the medical community by forcing us to financially contribute to acts we find morally reprehensible and by flat out ignoring our fundamental right to freedom of religion. The subjects of contraception, abortion, and the dignity of life are not new to the Catholic Church. They have been part of our central teachings for hundreds of years. President Obama created this bill knowing Catholics would be put in this position.
Eric, Laura is of the opinion that the Catholic Church must pay for abortions under this new bill. What is your view?
The morning after pill is not an abortion. It's far from it. The morning after pill does two things. It thickens cervical mucus, preventing sperm from reaching an egg, and it alters the lining of the uterus, preventing fertilized eggs from implanting. If a woman is already pregnant, the morning after pill will not abort the fetus. Such pills do exist and can be used up to 7 weeks into pregnancy. However, these pills are not covered by the Preventative Health Act.
Laura, can you comment on this?
The morning after pill is certainly an abortifacient. Life begins at conception, therefore as soon as the egg is fertilized, it is one of God's children, and the termination of that life should be considered murder. The morning after pill prevents a fertilized egg from attaching to the uterine lining and causes it to be expelled from the body. This is morally the same as a later stage abortion. There is no difference in the value of a life that is an hour old, a week old, or even 9 months old. Life begins at conception. Preventing a fertilized egg from implanting is preventing life, and the same as an abortion.
Laura, is there any time at which the Catholic Church deems an abortion to be permissible?
No, under no circumstances is an abortion ever morally acceptable. Human life is sacred because from its beginning it involves the creative action of God, and it remains forever in a special relationship with the Creator. God alone is the Lord of life from its beginning until its end. No one under any circumstances claimed for himself the right to directly destroy an innocent human being. The dignity of the human person is the foundation for a moral vision for society. Direct attacks on innocent people are never morally acceptable at any stage or in any condition. Life is sacred and it should be treated with respect.
What about rape or incest?
Both rape and incest are serious sins, but neither is a justification for abortion. The Church strictly prohibits any form of abortion. Rape itself is already a sin. Adding up another sin by having an abortion is not the answer. Not only does this new life have physical integrity, it also has a soul, created and infused by Almighty God. This unique human being has a right to life no matter no matter how he or she was conceived. The unborn child remains an innocent human being who has the right to life. The Church teaches us that human life is created and begins at the moment of conception. The Catholic Church sees abortion as the termination of an unborn life, and therefore it's always wrong, sinful, and immoral. The circumstances by which that life were conceived are considered irrelevant. A woman who has been raped may defend herself against conception resulting from a sexual assault if after appropriate testing there's no evidence that conception has already occurred. She may be treated with medication that would prevent ovulation, sperm capitation, or fertilization.
Eric, do you have any thoughts on Laura's comments?
Rape is a horrific act. It's up to the individual person to decide. If the woman who is raped feels that they could raise the child and love it, then great. If they don't feel that they can do that, then it should be up to them. It's not for the Catholic Church to decide, it's not for President Obama to decide, it's the individual woman's choice.
Laura, if the Preventative Health Care Act is not suitable, what other forms of contraception are acceptable by the Catholic Church?
The Catholic Church is not opposed to birth control. In fact, it encourages couples in the direction of what is called responsible parenthood. In considering how many children to have and when to have them, a husband and wife, according to the Vatican Council, will thoughtfully take into account both their own welfare and that of their own children. Common sense tells us that when a couple only should want to have as many children as they can properly take care of. This, of course, means different things to different people. For some couples, large families are a blessing. For others, a smaller number of children is the wiser choice. Either way, the point is that the Church does not teach that a couple should have as many children as possible. On the other hand, the official teaching of the Catholic Church does state that the artificial, meaning condoms, diaphragms, intrauterine devices, and chemical, the pill, foams, gels, those forms of birth control are always morally wrong. The Catholic Church only approves of natural forms of artificial birth control, the best known and most effective of which is the natural family planning method. The primary purpose of marriage and sexual intercourse is procreation. Every active intercourse must remain open to conception. Contraception destroys any potential to produce new life and violates the principal purposes of marriage. This contraception ban is against unnatural means of contraception, which include chemical and barrier methods.
One of the fundamental elements of human nature is human sexuality. We are all either male or female, and that identity plays a foundational role in our response to life. The sexual acts of humans are not just simply physical, they engage the entirety of the human person. Physical, psychological, and spiritual. Human beings have a profound need for intimacy with others, for getting to know and love others, on a deep plane and allowing others to know and love them. Humans desire and need stable and loving relationships, both for their own well-being and for the well-being of their children. Humanists agree that sex is used for procreation, but it also strongly supports our need to feel loved and belonging.
Let's bring the focus back to the contraceptions that are acceptable to Catholics. Let's not forget the primary focus for this discussion is to clarify the reasons as to why there is such a strong opposition to the mandate that all health insurance plans provide women's preventative health care services.
A basic human right would be one in which women would have a right to say yes or no to sex, without having to risk the rest of one's life. Birth control works by manipulating a woman's hormonal system. There is no life being aborted, it is being prevented. I have a list of stats on contraception that reveal why the option of birth control is such a valuable option to those in need, especially when healthcare supports it. What it boils down to is that the rhythm method has shown failure rates as high as 68%, while a modern contraception can reach as low as 1%. A 40-year study of 46,000 women conducted by the Royal College of General Practitioners found that women who take birth control pills have a longer life expectancy than women who have never taken the pill. The more contraception the population uses, the fewer abortions there are. From this information alone, it is a wonder why the Catholic Church doesn't support the new mandate.
A basic human right is to be allowed to follow the teachings of one's religion. It's also a legal right in this and many other countries, and it's being violated by this bill. I want to make it clear that the Catholic Church is in favor of preventative health services for women, excluding contraceptives, sterilization, and abortions. Mammograms, pap tests, pre- and postnatal care are all healthcare services that should be provided to women free of charge. These are the kinds of services the Catholic bishops have been fighting for.
Well, folks, it looks like we have time for one final question. As a response to the public opposition, the President has made some small modifications to the bill. Although women will still have access to preventative care, if an institution has religious grounds to oppose providing that care, the insurance companies will be required to provide it on their behalf. Laura, do you feel that this is an adequate compromise?
The exception made by President Obama is far from adequate. It is extremely limiting in who is exempt. Under the restriction, a religious employer who objects to medical treatment aimed at the prevention or termination of pregnancy may leave it out of their healthcare insurance coverage, provided the employer satisfies 3 criteria. 1, it has religious inculcation as its primary duty. 2, it primarily employs people of the same faith. And 3, it primarily serves people of the same faith. The problem is that many Catholic institutions employ people of different faiths and provide services that extend far beyond religious inculcation. Charity and community services like orphanages and soup kitchens are essential social services that the Catholic Church provides to communities in need. Under the exemption, they wouldn't be exempt from providing these kinds of services to their employees. Catholic universities and elementary schools wouldn't be exempt, and neither would Catholic hospitals. Any healthcare worker has the right to refuse participation in abortions, sterilizations, or any federally funded health service or research activity on religious or ethical grounds. They're protected by freedom of conscious laws that also protect their religious beliefs. Why are Catholics not being given the opportunity to refuse to participate in something we have a long history of finding morally objectionable? This can be seen as nothing other than an attack on the Catholic Church and the morals we stand for.
I feel it's a mistake. The Affordable Health Care Act is a human issue, not a religious issue. The government should not be making concessions for any special interest groups on any nationwide mandate. This sets the precedent to all special interest groups that if you complain enough, you can get out of anything. For example, if an individual doesn't feel that prison or the war on drugs are effective, can they just opt out of paying taxes for those two items because it offends their sensibilities? The unfortunate downside to democracy is that it's impossible to please all parties with every mandate. In order for the system to continue to work, it's sometimes required that everyone goes along with decisions even though they don't necessarily agree with.
Well, it looks like we're out of time for today. I would like to thank our guests, Eric and Laura, for coming in.
Thanks, Greg.
Thank you.
Signing off.